Good morning, everyone, and welcome to this meeting of the Mental Health Services Oversight and Accountability Commission. My name is Mara Madrigal Weiss, and I am the chair of the commission. I want to thank you this morning for attending. The commission's strategic plan for 2020 through 2023 is committed to 3 strategic goals and objectives to advance the commission's vision of well-being for all Californians. Cody, can you please bring up the strategic goals slide?
Actually, I do not have that slide ready yet, so we can put it up during the break.
Thank you, Cody. So then moving along, at this time, I would like to make a few announcements. The March 2022 commission meeting recording is now available on our website. And the next commission meeting will be on May 26th. And at this time, the location is still to be determined. So we will let you know as soon as we know. I am excited to announce that the commission has moved to a new location in Sacramento. We will now be located at 1812 9th Street. In Sacramento, the zip code is 95811. We also have a new phone number, which is 916-500-0577. We ask that all our partners and members of the public use this new contact information so we don't miss anything important. I'd like to now proceed to committee updates. So I would like to invite our chairs of the committee to make updates on their activities. I would like to begin by inviting Vice Chair Alvarez and Commissioners Danovich and Tamplin to provide their updates. So if we could begin now, thank you.
Sure, I can go. Thanks so much. Good morning, everybody. It's great to see your faces. Thank you, Chair Madrigal Weiss. The Cultural and Linguistic Competency Committee met last Wednesday, and we met for an unconventional meeting, but an incredibly valuable one. We spent the bulk of our time really building community, getting to know each other better, and hearing from each other about the people who have inspired us in our work, what solidified our interest in the committee, and what committee goals should guide the remainder of our work this year. It was not a typical meeting where we spend most of our time discussing specific content, policies, or particular programs and services. In this meeting, we paused to touch base and get to know each other a bit better. The time together was a response to a survey we conducted of committee members a couple of months ago, where we asked them about their experience on the committee. And we heard from many of our members that they wanted to get to know each other on a more personal level, to hear our stories, and to understand what drives them to do the work they do in mental health and equity. The work to advance equity is not only in the programs we fund or the people we serve, it's also in the culture we create to do this work. And so much of that starts with relationship building. So I'm incredibly grateful for the time people shared. I truly enjoyed listening to our committee members and members of the public, and appreciated the opportunity to reset and make plans for our future meetings. Just to reiterate, our committee goals continue to be to provide input on the Commission's Racial Equity Action Plan and efforts to address inequities in internal processes and grant programs. Second, to identify ways to document and communicate inequities in California's mental health systems that will inform policy and practice. And then third, to identify policy and practice reforms and explore existing efforts and model programs that address inequities. So for future focus areas, the committee offered several suggestions around how we can ensure supporting the delivery of culturally and linguistically competent services, including the importance of language access, community leadership, and disaggregated data. We also discussed again how we can lift up what works, such as Solano County's nationally recognized initiative involving the UC Davis Center for Reducing Disparities and Clinical and Translational Science Center. Again, that's focused on community engagement and quality improvement for marginalized non-English speaking communities. There is much more work to come, and we're excited to continue that work with the committee. I also want to give special thanks to Commissioner Roulette for joining us for that conversation. The next meeting of the CLCC will be May 12th from 3 to 5 p.m. Thanks.
Thank you so much, Vice Chair.
Okay, I'll go next.
Yes.
First, that was, oh, am I unmuted? Yeah, that was an absolutely outstanding update. I'm going to have to up my game for our subsequent updates. But fortunately for me this time, I have little to report. What I have to report that's most important that I don't believe has been previously reported to you is that Steve Carnevale, Commissioner Carnevale, has officially joined as the Vice Chair of the committee. Very pleased to have him join the committee. The Research and Evaluation Division is in the process of looking for a replacement for its director, which is really, really key to all the work that we're doing. And there's some outstanding candidates that are in process right now. So hopefully we will have more information soon about the new leader of that division. And our next meeting is scheduled for May 12th, which is going to happen by Zoom and in person. The meeting details, materials are going to be posted on the MHSOAC website on May 2nd, and look forward to that. The major focus of that is going to be reviewing what the committee has done over the last cycle, and essentially establishing consensus or an affirmative decision on re-upping the committee for this next cycle, since we're at the end of the initial committee term.
Thank you, Commissioner Dadovich. Commissioner Tamplin, please.
Thank you, Chair Madrigal-Weiss. And on Tuesday of this week, the Client and Family Leadership Committee had a panel presentation on the proposed care courts. Sally Zimin, former executive director of the California Association of Mental Health Peer-Run Organizations, CAMPRO, and Karis Myrick, co-director from the S2I Mental Health Strategic Impact Initiative and former president of NAMI National, presented on the feedback they have received to this point on the Care Courts Initiative. As most of you are aware, Senate Bill 1338, Umberg and Eggman, proposed community assisted recovery and empowerment care courts, which is based on a plan by Governor Newsom to get Californians who are in crisis off the streets and into housing treatment through a court order. Sally Zimin and Karis Myrick presented from an equity perspective, those who are impacted directly by the plan, and spoke about concerns that mental health peers, consumers of color, specifically Black and Brown communities have with this plan. They shared their opposition to the Care Court bill as it is currently presented, and outlined several concerns as they have with the bill. Generally, many are concerned with what they see as forced treatment by the court, as well as vague standards regarding who's eligible, no criteria for conservatorship, disparities again for Black and Brown citizens. The plan was felt that will not end homelessness without appropriate supports for housing, including support services in place. There are very viable, also we talked about viable alternatives such as system-based voluntary services, where similar to the Trieste model in Italy that target the same population but does it without coercion. The public has been talking about how public participation can be is vital, and we need more information on how to get involved with this plan. And the bottom line was that all the services that were being described in the plan could be offered without the courts and coercion. The CFLC, the Client Family Leadership Committee, was overwhelmingly opposed to the bill, as were the public comments. NAMI California spoke in favor of the bill as a mechanism to help individuals and their families. NAMI California stated they wanted voluntary participation first. While we did provide material from the administration, and we did receive feedback from participants that the panel should include both pro and con viewpoints. And I hear those concerns, and so we are having continued conversation about this fast-paced plan that to ensure again the voice and an equity approach is uplifted. We will invite presenters from the administration at our next meeting, and include again more of the voice of the community that is impacted, those that will be going through this kind of court process. And both presenters brought their national experience and knowledge on court-ordered treatment, the research behind it, the outcomes, and again, the impact on Black and Brown communities to the meeting. And we talked about continuing this conversation and again, inviting the administration who's in favor of the bill to present at future meetings. The time and date for our next Client and Family Leadership Committee meeting will be Tuesday, May 24th. And we are extending it in an hour, an extra hour, so from 1 to 4 p.m. We hope people will join. We hope commissioners and the OAC will look at this issue because it is something that is very important to our community. So thank you.
Thank you, Commissioner Tamplin. I appreciate the thoughtfulness. I understand this is a very passionate issue. And so I appreciate the thoughtfulness of bringing the partners together and continued discussion around this. So I look forward to learning more, and I appreciate your involvement in this. So thank you very much. At this time, I want to share that if I'm a little off my game, I am working from a different location, and so I'm trying to fumble through this. So bear with me, everyone. So again, thank you, commissioners, for leading the work that you are leading and for supporting us as we continue to move forward. At this time, I am going to share our instructions for public comment. If anyone is interested in making public comment regarding the announcements or other items, please make those during the general public comment time. Commissioners, if you leave the teleconference meeting for any reason and decide to join, please make sure to use the raise hand function so commission staff can make you a co-host again. If you have a comment to provide, please unmute your line and seek recognition when it is convenient. Lastly, if you have any technical questions, please contact Amariani at amariani.martinez@mhsoac.ca.gov. At this time, I will ask Amariani to go over the public comment procedures.
Thank you, Chair. All members of the public will have the opportunity to offer comment as described in the agenda. If you would like to comment on an agenda item, please wait until that agenda item starts. You may request to make public comment by clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. You will be placed in a queue to comment on that agenda item. When it is your turn to comment, the moderator will unmute your line and announce your name or the last 3 digits of your telephone number. When you are unmuted, we are able to hear you. We will do our best to take comments in the order they are received. Please note, once the public comment period for the agenda item starts, we will close the public comment queue. The moderator will insert the word "last comment" next to the commenter's name or number to identify the last public comment, so please make requests to comment as early as possible. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. When we have reached the end of your time, our staff will let you know, but we will let you finish your thoughts. We don't mean to cut you off, but we do want to help everyone keep time. We truly appreciate your understanding with this process. Lastly, if there are any members of the public using translation technology, please notify the chair, and at least twice the amount of time will be given to you during the public comment period. A live meeting transcription or closed captioning is available for anyone participating in the meeting. If that option is not currently visible, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. Chair Madrigal-Weiss, I hand it off to you.
Thank you, Mariani. With that, I want to welcome everyone again to today's meeting. Based on today's agenda and recognizing that Zoom meetings can be challenging, the plan is to end our meeting at noon or soon thereafter today. At this time, I will ask Maureen to please take the roll.
Yes. Commissioner Bontrager,
Here.
Commissioner Boyd, Commissioner Brown,
Here.
Commissioner Bunch,
Here.
Commissioner Carnavale,
Here.
Commissioner Carrillo, Commissioner Chen, Commissioner Cortese, Commissioner Danovich,
Here.
Commissioner Gordon,
Here.
Commissioner Mitchell. Commissioner Mitchell? I can see you. Okay. Thank you. Commissioner Rowlett,
Here.
Commissioner Tamplin,
Here.
Vice Chair Alvarez,
Here.
Chair Madrigal Weiss.
Here.
We have a quorum.
Thank you, Maureen. It is now time for general public comment. This time is reserved for comments on items that are not on the agenda. I would like to remind everyone, if you wish to make public comment, click the raise hand button on your computer or the app, or if calling in by phone, push *9. If you would like to comment on a specific agenda item, please wait until that agenda item starts, then raise your hand or push *9. Once the public comment period for the agenda item starts, we will close the public comment queue. So please make any requests for general public comment now. Please be prepared to complete your comments within 3 minutes or less. If there are any members of the public using translation technology, please let me know and we will make sure that you have sufficient time to make public comments. Amaniani, please open the line for general public comment.
We have 3 public comments. I'm so sorry if I mispronounce your name. Karis, your line is open. You may go ahead.
Hi, thank you very much. This is Karis Myrick. I'm a Los Angeles resident. I'm a person with lived experience of a mental health condition, a family member, and a national leader. I want to give some public comment, please, about Care Court and our ability to work together on Care Court, because we all, whether we have lived experience and or our family members, care about those who are in most need, who are living on our streets. One of our issues, at least from my perspective, that I've had about Care Court, that I've spoken openly about, are the continued disparities for Black and Brown people. That we are overrepresented on homelessness, we're overrepresented in getting diagnoses of schizophrenia, and therefore using a court system in order to address structural issues probably may not be one of the best ways to go. However, I think what has also happened is people who are opposed or want to improve what would happen in Care Court, meaning taking it out of the court, for example, have not been part of the process of meeting with the governor, meeting with Dr. Daly and the administration to work alongside those who are in support. I think it's going to be critically important that we work together, because having one side of an issue kind of push forward with, the governor meeting with Daly and all supporters, what about the opposition? That's not really a democratic process. And again, we are not opposed to the values and the principles of what's happening in Care Court. What we're trying to understand is, why is it happening in a court, especially a court that has no power? The court doesn't need to happen. And what is the role of the OAC in order to ensure that all voices, all sides, all opinions are taken into consideration, especially those with lived experience, those who are coming from racial and ethnic backgrounds, and those who may not agree. Thank you very much for this time, and thank you for your work, Commissioner. Thank you.
Thank you, Karis.
Okay, Stacey, your line is open. You may go ahead.
Good morning, Commissioners. Stacey Harimoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. First of all, I would like to welcome you all to a celebration that the California Reducing Disparities Project will be having later today. It starts around 12:30, so I know that's only a short time for your lunch, but it will be going on until 1:45. And if you tune in, I am sure you are going to really, really like it. It's going to be a happy event. We're going to share some results in a very personal way. I tried to get the invitation to most of you, but if you don't have it, Tom Orrick, I know, can give it to you, or you can email me. If I can't put my email in the chat, but again, I would like to invite everyone, the commissioners, the staff, and the public, but particularly the commissioners, if you're not familiar with this project, because originally this would have been the end of the project, but actually last year we were successful in getting the 63 million. So the project will be continuing for another 4 years. So thank you. Please join us today. I think you'll be thrilled, and we would be thrilled to have you. In my remaining time, I do want to support what Kara Smyrick, the woman before me, has said. I hope that the OAC does study this issue and take a position. The California Behavioral Health Planning Council took a position, and because this is such a major issue, I hope that the commission studies it and takes a position. REMCO has an official opposed position for the reasons that you've heard before by Ms. Myrick, but please, I hope the commission at least studies it, because again, the commission is very important and should have its voice heard on major issues. Thank you.
Thank you, Stacey.
Okay, next we have Chris. Your line is open. You may go ahead.
Great. Thank you so much, and good morning to the commission. My name is Chris Schultz, and I come to introduce myself. I am a board member of the newly formed SHCLA, Supportive Housing Community Land Alliance in Alameda County in partnership with the county. And so wanted to just come and introduce myself as a family member, as a lifelong passionate advocate for housing for people with severe mental illness. It has been an incredible honor and privilege to serve on the board of the organization, and to thank you all so much for your funding and your support of our work. I come to because we are a newly formed nonprofit, as you all are aware, under our current grant, and wanted to make sure that you all were aware that we have formed our board. We have hired our executive director, and we are moving forward with our strategic planning process to begin acquisitions and properties, and using the community land trust model to provide sustainable and dignified housing for people living with severe mental illness. However, we are facing some challenges right now that we would love to see the support of the commission to help work through. We have here as well our executive director, Tesla Mikaro, and so I'll let him speak more to that, but I just wanted to come as a board member and speak to the importance of this work, the progress that we're making, and really looking forward to your collaboration and partnership so we can continue to move forward with this great work. So thank you.
Thank you, Chris, for being here. Thank you.
Okay, and next we have Teslim. Your line is open. You may go ahead.
Great. Good morning. Thank you all for being here and for providing the forum for public comment. My name is Tesla Mikaro. I'm the executive director of the Supportive Housing Community Land Alliance, a new land trust in Alameda County that is laser focused on providing permanent supportive housing to individuals with severe mental health issues using the land trust model. As Chris mentioned, we have just recently completed our strategic planning process with our advisory committee and our board. We are now entering phase 2, which is the conclusion of project incubation through our partner NCLT, Northern California Land Trust, and moving into a period of relative independence as a newly formed organization. We had initially proposed a fiscal sponsorship relationship between our organization and NCLT, given the fact that our tax-exempt 1023 application at the federal level was just recently submitted in December and will likely be approved in August or September of this year. In the interim period, there will be a gap that would prevent the county from funding us directly. And so, hope to be in conversation with this body about a workaround solution to ensure that we can continue operations as previously expected. But again, really here in the spirit of building relationships, as Vice Chair Alvarez, mentioned earlier, and want to make ourselves available to you as a body to answer any questions or comments you might have about our current development. So thank you for the time.
Thank you, Teslim, for that update and for being here today. Appreciate that.
And that was our last public comment.
Thank you, Amarani, and thank you all who made public comments. We value those and we are listening. At this time, I would like to approve the March 24th meeting minutes. So the commission will consider approval of the minutes from the March 24th, 2022 teleconference meeting. At this time, members of the public may request to make a public comment on item 1 by clicking the raise hand button on your computer or the app, or if you are calling in by phone, push *9. Once the public comment period for this agenda item starts, we will close the public comment queue. So please make your request to comment now. Commissioners, are there any questions or comments at this time? I am seeing none. Is that correct? That's what I see. I see none. Are there any public comments? Please raise your hand now as the queue will be closing. I also see none. I'm asking staff to help me out because my screen is very tiny.
No, there is no public comments.
Okay, so commissioners, then do I have a motion to approve the meeting minutes for March 24th?
So moved.
Thank you.
Second, this is second.
Thank you, Commissioner Rolette. Any additional questions or comments from our commissioners? Seeing no hands raised, I will ask Maureen to please call the roll.
Yes, certainly. Commissioner Bontrager.
I wasn't present, so I abstain.
All right. Commissioner Boyd, Commissioner Brown,
Aye.
Commissioner Bunch,
Abstain.
Commissioner Cardavale,
Aye.
Commissioner Carrillo, Commissioner Chen, Commissioner Cortese, Commissioner Danovich,
Approved.
Commissioner Gordon,
Aye.
Commissioner Mitchell, Commissioner Mitchell,
Approved.
Commissioner Rolette,
Aye.
Commissioner Tamplin,
Aye.
Vice Chair Alvarez,
Aye.
Chair Madrigal-Weiss.
Approved.
The minutes are approved.
Thank you. We're moving on to our second item on the agenda. For item agenda 2, the commission will consider approval of $3,500,000 approximately innovation funding for Butte County's Resilience Empowerment Support Team, REST, at Everhart Village. We will be hearing a presentation from Holly Drobny. I hope I pronounced that correctly. Drobny, I apologize. I think I got that right. Drobny, who is the program manager and MHSA coordinator for Butte County Behavioral Health. Commissioners, you were provided with the staff analysis and PowerPoint for this presentation, and the materials are also posted on the MHSOAC website. We are excited to discuss the innovation project. Members of the public may request to make a public comment on item 2 by clicking the raise hand button on your computer or the app, or by pressing *9 on your phone. Once the public comment period starts, we will close the public comment queue. So please make requests to comment now or as early as possible during this presentation. Thank you for joining us today, Holly. We would like to hear a high-level overview of the needs in your county which promoted this innovation project, how the project will address the needs, and how you plan to measure outcomes of the proposed project. To ensure we have enough time for discussion, we ask that you limit your remarks to 5 minutes so that we can focus on questions and discussions with you thereafter. So Holly, I welcome you to begin.
Thank you, commissioners, for having me today. That is not our presentation.
We just wanted to make sure that you were paying attention.
Yes, I drank my coffee this morning.
Okay, there we go. We will take care of that right away.
Yeah. Okay, that looks better.
All right.
Okay, good morning, commissioners. My name is Holly Drobny, and I serve in the role of MHSA coordinator for Butte County Behavioral Health. Today, I'm here to present the Resiliency Empowerment Support Team, also known as REST at Everhart Village. Next slide, please. In Butte County, a combination of local disasters, rural characteristics, and a significant prevalence of co-occurring disorders has reached a crisis point that requires innovative action to develop future best practices to mitigate barriers to treatment. We estimate that we are currently treating only 19% of the mentally ill homeless population in our county. According to the U.S. Department of Housing and Urban Development, on average, 25% of the homeless in America are seriously, persistently mentally ill. The number of homeless people in Butte County with a severe mental illness could therefore be assumed to be 576, which is 25% of the homeless as reported in the 2019 point-in-time census. In Butte County Full Service Partnership programs, 111 of the participants self-report as homeless. Therefore, we are estimating that we are serving 111 out of the potentially 576 homeless individuals with a mental illness. In collaboration with local stakeholders, we have identified a multitude of barriers that limit our ability to engage individuals who are eligible for our services and who would benefit from treatment and support. This project seeks to contact and engage with the estimated remaining 81% of the unhoused people that are in our community who need our help. Some of the barriers to treatment that exist include an individual's specific circumstances, and examples can include stigma, functional impairments, addiction, lack of housing, or complex health issues. And at a provider level, we face barriers with reaching folks due to the service delivery structure and contacting individuals who are indigent. Butte County is a rural, low-income county facing many socioeconomic challenges, including high rates of substance use and mental health issues, a high rate of aging and vulnerable populations, and we have the highest adverse childhood experience scores in the state. In addition to the already mentioned circumstances, Butte County has experienced the devastation of several communities by wildfires in just 2 short years. Homelessness grew drastically with the destruction of 19% of the county's housing stock in the 2018 Camp Fire, and homelessness continued to increase after the North Complex fire in 2020, and even more so with the additional layer of the pandemic. Next slide, please. The current service delivery system is working well for clients that are motivated and high functioning enough to engage in treatment, and is not working well for individuals that are not able to engage in ongoing outpatient mental health services. The REST project will provide a collective framework to promote engagement in services, which will reduce negative outcomes of untreated mental illness and/or co-occurring disorders. The entry point to this framework begins with an intensive outreach and engagement team, which will be staffed with a licensed clinician, counselors, peer specialists, a nurse, and a part-time psychiatrist, providing various health interventions. This team will meet people where they are geographically and psychologically. They will work to build relationships with people who would benefit from services. This team will have access to funding to meet basic needs for people that are living unsheltered on the streets. REST candidates that are not homeless are also a target population for the REST program, and referrals will be accepted from community members through our access line. The REST staff will exclusively provide referrals to Everhart Village, an emergency shelter dedicated to this specific project, consisting of 15 to 20 sleeping cabins co-located next to the largest behavioral health service site in Butte County. Everhart Village is walking distance from behavioral health and many community resources, including the Iverson Wellness and Recovery Center and multiple bus stops. The village will be facilitated by a local nonprofit called the Chico Housing Action Team, who has extensive experience in working with and housing our clients. REST participants at Everhart Village will have an access to a menu of services and support, including mental health treatment, substance use treatment providers, peer support specialists, care coordination, housing case managers, and medication support. REST participants will benefit from an on-site pharmacy, a community resource center with showers and a kitchen, and a computer lab embedded in our behavioral health building. Ampla Health is a comprehensive healthcare provider in close proximity to Everhart Village, and they have expressed their support and commitment to this project to coordinate medical services for REST participants and their potentially complex medical conditions. Peers will be the main source of client support in keeping with the core values and best practices of peer service to coordinate personal care, including physical health, social services, legal services, housing support, and medication management. Services provided on-site at Everhart Village will be provided by a blended team of REST staff and current full-service partnership staff, depending on the level of engagement of each resident to ensure a warm handoff into services. Next slide, please. One of the most important and innovative aspects of this project is the co-location of resources available to the REST participants. This slide shows a visual depiction of the close proximity of Everhart Village and the services mentioned on the last slide, in addition to the Butte County Psychiatric Health Facility, the Crisis Residential Facility, Crisis Services, Outpatient Services, Ampla Health, and the Chico DMV. Services in the area not included in this picture include our youth outpatient services, who will serve youth up to 25 years of age. Next slide, please. In 2019, 4 innovative concepts were introduced by stakeholders, and the public was given the opportunity to rank the concepts on the most urgent need for innovative funding. The results indicated overwhelming support for innovative services at a tiny home village. Notable feedback given during this process provided the launch point for the proposed project. And over the next 3 years, community and stakeholder feedback continued to support the vision, including 142 survey respondents who provided direct input on the proposed project in 2021. Various work groups were developed to design this proposal, including members of the Chico Housing Action Team, the MHSA Steering Committee, and various behavioral health department staff. The department collaborated with Community Whole Health Alliance, also known as CWA, which is a local peer-led organization who recently achieved nonprofit incorporation. CWA provided critical input on the peer specialist component of REST, which led to the introduction of a new position in the Butte County system of care, a peer specialist counselor. This will be a hybrid position that will utilize lived experience to provide support and care coordination in keeping with the core values and best practices of peer service. The peer specialist counselor will achieve statewide peer certification and will act as the bridge between counselors and peers, promoting synergy within the REST team. In 2021, the Behavioral Health Advisory Board and Butte County Board of Supervisors adopted a resolution to opt out of Laura's Law and affirmed their support that the REST project would be an appropriate alternative for Butte County. During the 30-day public comment period, 35 submissions were received via email. A brief summary of this feedback, including the department's response, can be found in the final proposal on page 37. It should also be noted that Butte County Behavioral Health has received many letters of support for this project, including local law enforcement and local homeless service providers. Next slide, please. Ultimately, Butte County Behavioral Health seeks to learn if the REST project will be more effective in achieving long-term outcomes for community members than the traditional outpatient structure. Behavioral Health will study the following research questions and will utilize established performance measures to evaluate the success of the project. The 6 learning goals are as follows. Is intensive outreach effective for engaging the target population in services? Does on-site housing facilitate client engagement? Is the overall REST approach of intensive outreach, coordinated care, and on-site housing effective for engaging the target population in services? Does continuous quality improvement improve program and clinical practices and thereby improve client engagement? Will we be able to help the REST target population with mental health, substance use, and functional impairments? And finally, will we be able to help the REST target population to obtain stable, long-term housing, reduce its utilization of crisis services and hospitalizations, lower arrests, and raise employment. Next slide, please. Butte County is requesting the authorization to spend up to approximately $3.5 million in MHSA innovation funding for this project over a period of 5 years with a start date of July 1st, 2022. The total project cost is estimated to be closer to $6.4 million, with Medi-Cal and federal financial participation funding the remaining amount. Thank you for your time and attention to this presentation. The behavioral health team is ready and available for questions.
Thank you, Holly. At this time, I will ask commissioners, are there questions or comments regarding Butte County's plan? Okay, yes, Commissioner Rolette, please.
So I'll make a couple of comments. Thank you, Chair. First comment is I note that you have a letter of support from the African American Family and Cultural Center, and recognizing that there is a significant workforce challenge, and that includes Butte County in California. My hope would be that you would consider the utilization of the perspectives of organizations that are embedded in the community to help facilitate the kind of outcomes that you reference here. The other suggestion for consideration is, certainly I know you're familiar with the importance of flourishing and how that points to a reduced dependence on specialty mental health services. And given the proximity of the program to mental health services, the hope is that individuals who we are privileged to engage and support would not be dependent upon those services throughout the totality, and I'll just say it for the sake of their lives, but really look to their community and then begin to flourish in their community. And that as you do your research, that you understand the dynamic and even report regarding the dynamic associated with having people be in such close proximity to so many services. And the hope is that they would not be dependent on those services and would be dependent on the community in order to sustain flourishing. Because again, as you said, in order to reduce the kind of utilization that you were targeting, that's what I believe you want. And then lastly, while I didn't hear a lot about I think it was approximately 500 individuals that are identified as homeless that you are targeting, my, again, assumption is that there are a disproportionate number of people of color that are represented in that number as compared to the population at large. And so the emphasis in utilizing groups like the African American Family and Cultural Center, who wrote the letter of endorsement, I think would be very helpful. Those are my comments.
Thank you. I appreciate your comments.
Thank you. Any other commissioners, comments or questions? I see in the OAC room, is that Commissioner Mitchell?
Yes, Commissioner Mitchell here. Overall, I like the sound of the program. So it definitely resonates with me. That's all.
Thank you, Commissioner Mitchell. Any other comments or questions from my commissioners? At this time, I see no others. Are there any public comments?
Yes, we have 4 public comments. Gretchen, your line is open. You may go ahead.
Thank you. Can you hear me?
Yes, we can hear you.
Thank you. My name is Gretchen Bender. I'm a director for an organization called Healthy Rural California. We seek to improve equity and access to health services in the rural North and represent Healthy Rural California on Butte County's MHSA steering committee. I came in late in the game and read the plan and the proposal for the REF team, and so am I passion, ability to and Butte County and struggle with connecting these vulnerable populations to, on their own terms and you know, where they reside. So just for that, my support.
Thank you, Gretchen.
Okay, next we have Andrea Crook. Your line is open. You may go ahead.
Hi, can you hear me?
Yes.
The last speaker was really coming in and out, so I wasn't sure if it was my Wi-Fi because yesterday I had the Wi-Fi day from you know where. But hi, my name is Andrea Crook. I'm the Director of Advocacy with Cal Voices, and I just had to chime in and say I absolutely 100% support this plan. I am so impressed with Holly and her team. Truly, their commitment to, you know, elevating the voices of the most vulnerable in Butte County, who has been through absolute hell and back. Their ability to rebound and to not waver has just been commendable. And I wholeheartedly support your efforts. And I thank you for such a beautiful presentation and all the hard work that went into it. I know it takes a village, so to you and your team, thank you.
Thank you, Andrea.
Okay, next we have Avery. Your line is open. You may go ahead.
Hi, thank you so much. My name is Avery Hulag Vicente, and I'm the Advocacy Coordinator for the California Association of Mental Health Peer-Run Organizations, also known as CAMPRO. I'd like to echo everything Andrea Crook of Cal Voices had mentioned, agree with everything that she had said. We applaud this plan and the inclusion of peers in the planning process, as well as building out this innovation plan to include peers in the whole plan in itself, in its execution. And also I'd like to say that this is a great example of a voluntary treatment option that includes peer services and doesn't involve the court system. So CAMPRO supports this innovation plan. Thank you for letting me share that. Thank you.
Thank you, Avery.
And last we have Andrea Wagner. Your line is open. You may go ahead.
Hi, I'm Andrea Wagner. I'm the interim executive director for CAMPRO, and I echo what my colleague Avery has just said. But I also want to say I am a resident of Butte County and have been personally involved in the development of this REST project as a community member, and fully support what they're doing. And I just want to echo that the amount of involvement that they have had with the consumers in Butte County to build this project and the community members and the allies has been so amazing to watch, and really an example of what we always talk about having consumers involved in the conception, the planning, the building of a project, and in the implementation. And they've really done that here. And so it's not often we can come and say that as peers, to say that they were, but I personally witnessed it and saw how even in the name of REST, they got the community to give input, and consumer groups suggested names and the community voted on it. So, I mean, this really has been a collaborative process with the community. And even in the rollout, they made changes at the very last minute at the input from community consumers. And so I'm very much as a CAMPRO member and as a community member in support of this REST project. And I think Butte County and Holly's and team and Scott Kennelly have done a really great job of opening the door for the community advocates to come in and have voice and participation, not just input that goes nowhere. They actually have opened the door for Campro and visit with us monthly with our community trainer for peer certification as well. So I applaud Butte County for the efforts they're making and choosing to do this instead of implementing assisted outpatient treatment and this voluntary community option instead. So I'm looking to them to be an example for other counties. And thank you for your time today, commissioners.
Thank you, Andrea. I really appreciate you being here and sharing perspective, both from the Campo perspective and as a community member. That's refreshing to hear. So thank you for being here and sharing that. We very much appreciate it. At this time, I would ask if there are any other commissioner questions or comments.
Yes, Chair, this is Dave Gordon. I just wanted to mention that I had spoken to several of my education colleagues in Butte, and there is extraordinarily strong support for this project. People there have been sticking together, and it's an extraordinary collective effort. So I'm happy to move approval of the item.
Thank you, Commissioner. Commissioner Templin, I saw you want to speak. Did you want a second or did you want to comment?
I wanted to second it.
Thank you, Commissioner Templin. And I see that Commissioner Brown, you'd like to speak.
Yes, thank you, Chair. I just wanted to comment on this project and this presentation. I think it's very well conceived. It was very well written. It was very well presented. It's really, I think, one of the best presentations that I've seen in front of this group. It takes several different problems and combines them in a way that I think could become a model for other communities. Transition housing, intensive mental health care treatment, healthcare treatment, others. In the close proximity that you've planned this, I think is extremely promising. And not only does it provide those services to people struggling with with serious mental illness and with homelessness, but it does so in a region where so many other people have been devastated and have had to struggle with sudden homelessness. And I just think you are all to be commended for this, and I will proudly vote for it.
Thank you, Commissioner Brown. If there are no other questions or comments from my fellow commissioners at this time, it appears that we do have a motion and a second. I believe I am accurate in saying that. So the proposed motion is to approve Butte County's innovation project. And Commissioner Gordon opposed the motion. Commissioner second. So at this time, are there any other additional comments after the motions? Seeing no hands raised, I will ask Chief Counsel to please call the roll.
Certainly. Commissioner Bontrager.
Aye.
Commissioner Boyd. Commissioner Brown.
Aye.
Commissioner Bunch.
Aye.
Commissioner Carnavale.
Aye.
Commissioner Carrillo. Commissioner Chen. Commissioner Cortese. Commissioner Danovich.
Aye.
Commissioner Gordon.
Aye.
Commissioner Mitchell.
Approved.
Commissioner Rolette.
Aye.
Commissioner Tamplin.
Aye.
Vice Chair Alvarez.
Aye.
Vice Chair Madrigal, Chair Madrigal-Weiss.
Approved.
The motion passes.
All right, congratulations, Holly and Butte County. Very happy for you. I too thought this was very thoughtful, from showers to pharmacy and everything in between. Good luck. We hope to hear.
Thank you. Thank you all very much. Thank you.
Take good care. All right, with that, we are moving forward. We now have the City of Berkeley Innovation Project approval. So for agenda item number 3, the commission will consider approval of approximately $2,800,000 in innovation spending funding for the City of Berkeley's encampment Community-Based Mobile Wellness Center Innovation Project. We will be hearing a presentation from Karen Klatt, who is an MHSA coordinator for the City of Berkeley's Mental Health Division. Commissioners, you were provided with staff analysis and PowerPoint for this presentation, and the materials are also posted on the MHSOAC website. We're excited to discuss the innovation project. Members of the public may request to make a public comment on item 3 by clicking the raise hand button on your computer or the app, or by pressing *9 on your phone. Once the public comment period starts, we will close the public comment queue, so please make requests to comment now or as early as possible during this presentation. Thank you for joining us today, Karen. We would like to hear a high-level overview of the needs in your city which prompted this innovation project, how the project will address the needs, and how you plan to measure outcomes of your proposed project. To ensure we have enough time for discussion, we ask that you limit your remarks to 5 minutes so that we can focus on questions and discussion with you thereafter. So Karen, welcome.
Thank you. I appreciate the opportunity to meet with you and provide this high-level overview of our project, which we're very excited about locally because it was born out of a real partnership with our homeless encampment community members, as well as community-based organizations that serve this population to find a solution to what would help increase mental health, address the mental health needs. I'm going to turn off my video during the presentation, and I'm going to launch right into it. If you could move to slide number 2. Okay. So despite, what's not working? What's not working in our community is that despite having multiple, despite having mental health and wellness needs among the unhoused community members in Berkeley, participation in services remains very low. We've done all kinds of outreach teams, both through the mental health division and then through partnerships. And they've been funded over the years in the city to try and connect unhoused individuals to mental health services. However, there remains a large set of individuals who indicate that they are uninterested in services despite appearing to have mental health conditions. A lot of times this might be due to having a distrust with systems or having trauma issues. But at any rate, it's we've been unsuccessful in having a good rate of connecting individuals to mental health services, as well as just increasing their, having more positive mental health outcomes. So if you'll go to slide number 2. Slide number 3, I'm sorry. Okay, so slide number 3. So how does this innovation project address the problem? The proposed project is a direct result, as I mentioned, of input from individuals who are experiencing homelessness on the types of services and activities that will support their mental health needs. By implementing a mobile wellness center that hosts regular customizable services on site, which are chosen by individuals residing in the homeless encampment, outreach can transform from the outside in to the inside out, and from sporadic to ongoing, and from disconnected to integrated. The proposed project adapts existing homeless outreach practices in the following ways. For service provision, rather than operating on a blanket assumption that clinical and or psychiatric services should be prioritized, the Wellness Center project will focus on services explicitly identified by unhoused community members to be most supportive of mental wellness. The service location, it will be a mobile service center that will be stationed at homeless encampments in Berkeley on various days. So, it might be in a certain place on Tuesdays, another place on Thursdays, and that will become well-known within the community. Service providers will be wellness center staff, and it will include a program manager, and a program, and then peer providers, which will include individuals with lived or adjacent experience of homelessness and or recovery. In addition, the Wellness Center program will use funds to compensate partners from within the encampment to connect consumers to services, incentivize program participation among existing and potential consumers, and engage in day-to-day program planning and operations. The main service areas, and this was again bore out of input that we received from all of the community input that we did, and from surveys and interviews with homeless individuals, was that they fall into these 4 areas: food and hygiene, benefits enrollment and navigation, trauma-informed wellness services, and enrichment and community services. And then I just a quick little thing about the fact that, again, we're going to have a peer-led service delivery team, including basically wellness ambassadors from within the encampment. And our goal is to reach 550 individuals over the course of the project. This would be about 250 a year, but with some coming in and out of the project. So maybe about 75, are going to be repeating and stuff. If you'll go to slide number 4. So we had a really very big engagement process. We actually used a consultant, Resource Development Associates, and the community planning and plan development process, for the project was conducted by Resource Development Associates in late FY20 and early FY21. We went through a whole bunch of different activities to meet the community engagement process, to be able to get a full-fledged participation in the community. First things were that we had virtual town hall meeting where we had 30 participants. This was to just kind of get general input from the community, anyone who wanted to participate. And as well as that was in October 20, and then October and November, we did online community surveys that was open to the full community. And launching in November through December of 20, we had interviews and surveys with community members experiencing homelessness. Let me back up for a minute. For the community participation, we had 132 participants overall between the survey and the town hall. And then for interviews and surveys among homeless encampment members, we had 38 participants. Following this big fleshed out outreach to the community, and we took all the input that we received and went to the virtual meetings with stakeholders working in housing and homelessness and mental health organizations. We had 18 local organizations who then took the input that we received and kind of fleshed it out into what would work. What are some existing kind of things that are working or not working? What have we heard from the community? Basically, the community input that we heard from just the basic community, that it fell into 4 areas that we were obtaining input, which included what are the biggest mental health needs, what would it make the biggest difference, what are the existing barriers that can be leveraged, and what are the biggest barriers in having homeless individuals obtain mental health services. And for individuals who are experiencing homelessness and mental behavioral health needs, we asked them, what are your biggest mental health needs? What has helped in supporting your mental health? What additional services do you need? And what makes it difficult to support your mental health? All this information again went to the 18 local, went to the virtual meetings where we held with local organizations who were very familiar with the services being provided and what's been working and everything to flesh out a project. From there, once a project was kind of fleshed out, we also asked our mental health division staff, we did a survey with them of 40 responses. There were 40 responders from that. And then in August of 2021, we went to our advisory committee meeting. The advisory committee was actually involved in this project all along, just kind of with updates, but this was kind of once we had a fleshed out plan. And we also got feedback from the OAC staff on it. And then that also went to the Mental Health Commission for feedback in September 21. And then following that, we did a 30-day public review, as you know, that I extended over from December through the end of January. And then we followed that with a public hearing, and we just got this approved through City Council on March 22nd. If you'll move to slide number 5. So our learning goals. The first learning goal is, does on-site wellness center services in an encampment environment have an impact on consumers' self-reported overall health and mental health? The proposed measurements are through pre and post surveys, focus groups, and on-site observation. And what we're going to be looking at is the number and percent of self-reported changes in overall health and also self-reported changes in mental health. Learning goal number 2 was, do on-site wellness center services increase the uptake of mental health services more broadly among consumers? The proposed measurements are through interviews with wellness center consumers, staff, and community-based service providers, and programs level service referral linkage, and then referral and linkage data. And we're going to be looking at the number of new service referrals, the number and percent of linkages to services, the number and percent of engaging in services, existing referrals and service engagement for wellness center consumers with prior services referrals. And then learning goal number 3, how does having individuals from the community and helping from the community help to provide services shape service delivery, including the satisfaction with services? The proposed measurements were to have focus groups and utilize pre and post satisfaction surveys and on-site observations to understand the percent satisfied with wellness center services, the number and percent of new versus returning consumers, the number and percent of consumers recruited to wellness center services via the ambassadors, the individuals within the wellness community, and then the uptake of services between wellness center consumers and baseline service uptake. So we'll be doing this through an evaluation with an outside consultant who will be conducting the evaluation. If you'll go to slide number 6. So again, our project is for $2,802,400 over a 5-year period, and we anticipate beginning within the first year, we'll be kind of working on our RFP and getting a local community-based organization on board who will be implementing this project, and we'll be working on procurement, which will be getting a van outfitted for this project and getting our evaluator on board. You can go to slide number 7. So now is the time for comments and questions. Again, this is kind of a very high level overview, so we can dig down if there's any questions.
Thank you very much, Karen. At this time, I would ask if there's any commissioner questions or comments regarding this plan. Commissioner Carnevale.
Thank you, Madam Chair. Really just a comment rather than a question. I love the proposal. It looks like an urgent need. If I'm recalling right, I think at the last meeting, we also heard a proposal for a mobile response to one of the counties. And so it just occurs to me, it's more of a comment for staff that if mobile is an innovative, effective way of delivering service, which makes sense to me, even though I know there are differences from county to county, driven probably by geography, among other reasons. We should be looking at this on a larger system basis and finding out who is and who isn't doing mobile services, maybe collecting best practices, finding some way to benchmark against them in order to measure the ones that are most effective, just, standard practices to help catalyze these good ideas across the state. Thank you.
Thank you, Commissioner Carnevale. Do I have any other commission questions or comments?
I'll share, Chair Madrigal-Weiss. Just again, my appreciation for this innovation proposal. Similar to Butte counties, I feel like there's been a real focus on how to meet people where they're at, how to really focus on those needs that promote therapeutic relationship and engagement and build trust. So one's process of recovery is supported in their journey and not forced. So really appreciate City of Berkeley for this proposal, and I look forward to supporting it.
Thank you, Commissioner Templin. I too want to make a comment. I very much appreciate the peer staff members, and when I read through these plans, I highlight those things that really stand out to me. And I don't know if you can see this, but pretty much the whole page was highlighted here. Members of the encampment community where it says we will utilize members of the encampment community in order to promote and incentivize potential unhoused individuals to connect with services provided by the Mobile Wellness Center. I really appreciated that. So not just the peer support, but really bringing in the community that you're trying to serve. That to me is, it's being restorative, it's doing things with, and not just with the peer support, which I greatly appreciate, but really tapping into the community that you're working with. So I was extremely impressed with that. So thank you, Karen. Thank you for the presentation. And at this time, I would like to move forward to public comments. So if so, please raise your hand. Amarani, if you can get us started, please.
Okay. We have 2 public comments. The number ending in 837. Your line is open. You may go ahead.
Yes, this is Mark Karmatz from Los Angeles, and I would like to ask, is the pool of consumer champions are they being involved in this? And if not, why not? And I would think that Katera would be the one to answer that question. And I'm sorry I targeted you.
I think Karen can also answer, but definitely there's the POCC, whose name has changed to Peers Organizing Community Change now, are very supportive of this too and involved. They have City of Berkeley, Berkeley Mental Health has its own POCC chapter 2. And so Karen, if you want to add more to that.
So yes, then.
Yes, hi. Oh, go ahead. Go ahead.
What does REST stand for? Because maybe we can, we have a huge homeless population in Los Angeles. And I was just up in Santa Cruz. They also have a homeless issue. So it might be a good idea to network with them and to find out what's going on there for the people who are homeless.
Thank you for your comments. Yeah, I know that we have a pool of consumer champion chapter, like was said, in Berkeley, and they were part of who could inform the process. And going forward, these updates will be actually, include community input about what's going on. And then we also we're going to build in a whole sort of like a board of homeless stakeholders, individuals who are friends with the encampment. This could include the pool of consumer champion members who are going to be looking kind of as a sort of oversight and kind of advisory body on this as well, to be informed about what's going on and can advise them those ways. So I do appreciate you bringing this up.
Thank you very much. Appreciate your letting me in.
Absolutely.
So,
Okay, next we have Andrea. Your line is open. You may go ahead.
Hi there, Andrea Crook, Director of Advocacy with Cal Voices. And I appreciate you answering Mark's question. I know that's something that the commission rarely allows responses to public comments, so I appreciate you doing that. Additionally, I want to just echo the commissioner sentiments on this plan and give my full support to this plan and let you know that this is just a really great commission meeting, because there's some really good stuff coming forward. So thank you.
Thank you, Andrea.
And then our last public comment is Avery. Your line is open. You may go ahead.
Hi, everyone. My name is Avery Ho, Advocacy Coordinator for California Association of Mental Health Peer-run Organizations, CAMPRO. Yes, everything that Andrea of Cal Voices said and everything that Commissioner Tamplin said, we support this plan. Anything that puts peers at the center of services and thoughtful outreach highlighting the peer expertise. So yes, what a great meeting. Thank you.
Thank you. All right, I see no other public comments. So at this time, I would ask, do I have a motion? And maybe we want to see the motion on screen. There it is. So
I motion to approve.
thank you, Commissioner Bunch. I want to say that I heard Commissioner Mitchell second. Is that correct?
Correct.
Thank you, Commissioner Mitchell. Any additional questions or comments from my commissioners, my fellow commissioners?
I just have one quick comment. Sorry, let me turn my video on. We have a mobile unit in LA County as well. And I think one of the things that's come up that you might want to think about and prepare for is there's been a lot of, I love it. I think it's great. It's taking the services where they're needed. It's bring it to the clients. But there have been a lot of questions around issues of safety with our unit. So that's something that you might want to just keep in mind and prepare for as you guys move forward.
Thank you.
Thank you, Commissioner Bunch. So with that, we have a motion, a second. Maureen, I would ask that you now please take roll.
Okay. Commissioner Bontrager,
Aye.
Commissioner Boyd, Commissioner Brown,
Aye.
Commissioner Bunch,
Aye.
Commissioner Carnavale,
Aye.
Commissioner Carrillo, Commissioner Chen. Commissioner Chen, you're muted.
Aye.
Thank you.
Thank you.
Commissioner Cortese, Commissioner Danovich,
Aye.
Commissioner Gordon,
Aye.
Commissioner Mitchell.
Approved.
Thank you. Commissioner Roulette,
Aye.
Commissioner Tamplin,
Aye.
Vice Chair Alvarez, Chair Madrigal-Weiss.
Approved.
The motion carries.
All right, congratulations, City of Berkeley. We wish you the best.
Thank you so much. Thank you for the time today. I really appreciate all the and the community input as well. Everything goes into making the project better. So thank you so much, everybody. Really appreciate the approved vote.
Thank you for that. Take good care, Karen.
Thank
So
you.
at this time, we have reached a break. We are ahead of schedule. So I'm going to say we're going to take 15-minute break so we can really stretch, move around, go get more coffee or water. We will see you back in 15 minutes. That is 10:35, 36, but we'll see you back at 10:35. All right, see you soon. Thank you. Okay, we'll be gathering back. I know I said 10:35, so we got about a minute. This is just reminding you we're starting to come back. Toby, thank you so much for putting our strategic plan goals and taking them off. So catch me if you can. Thanks for putting them up. And there's always a copy in your packet as well. So appreciate that, Toby. It is 10:34. We will get started at 10:35, which it now is. You see that? It's magical. All right, 10:35, moving along. We are now at item 4, legislative priorities. The commission will consider approval of legislative and budget priorities for the current legislative session. Norma Pate, Deputy Director of the Commission, will present a summary of the Commission's recent legislative priorities. Members of the public may request to make a public comment on item 4 by clicking the raise hand button on your computer or the app, or by pressing *9 on your phone. Once the public comment period starts, we will close the public comment queue. So please make requests to comment now or as early as possible during this presentation. Norma, I hand it off to you.
Thank you, Chair. Anyone else in the room with Norma, if you could mute your sound, not your microphone, but your sound, should be good. Okay, I think we're good now. Sounds good.
Thank you, everyone. Good morning. As you're aware, the Commission's staff provide guidance on legislative proposals under development, proposals that would impact the Commission's operations, or proposals that would result in new duties for the Commission. This year, the Commission has voted on to support 2 bills, AB 748, authored by Assemblymember Carrillo, which would which requires school sites, in grades 6 to 12 to display a poster on student mental health, and directs the Department of Education to develop a model poster for schools. This bill has not been amended since the Commission voted to support the bill in January, and is currently assigned to the Senate Policy Committee. As you recall, in March, the Commission voted to support AB 2281, authored by Assemblymember Tom Lackey. This bill was amended on April 21st and is now titled the Early Childhood Mental Health Services Act instead of the Mental Health Preschool Services Act. The bill requires the Commission to award grants to eligible entities or partnerships to improve access to and quality of services and supports for children from birth to 5 years of age inclusive, and their parents, families, and caregivers, with emphasis on prevention and early intervention and disparities. The bill also requires the Commission to develop criteria to award grants to eligible entities or partnerships. Executive Director Ewing testified at the Assembly Health Committee hearing on the 26th. This bill passed the Policy Committee and is now with the Assembly Appropriations Committee. Currently, there is no dedicated funding to award grants under the Early Childhood Mental Health Services Act. If funding becomes available for this grant program, eligible applicants will include childcare, early child education providers, community-based organizations, healthcare providers, including those with experience in maternal mental health, local government agencies, including counties, healthcare entities, and others as determined by the Commission. Applicants will be required to provide a plan with specific goals listed in the bill, such as preventing the onset or escalation of mental health needs and improving timely access to services and addressing disparities and the needs of underserved populations. The plan also includes the proposed use of funds, including how funds will be used to facilitate access to care, services, and support, and how those activities may be sustained following the end of the grant funding. Additionally, the applicant's ability to obtain federal Medicaid or other reimbursement, including EPSDT funds, County Mental Health Services Act funds, or to leverage other funds. Should funding become available, the Commission will determine how to best award the funds to organizations that will provide support services that may include parental suicide prevention services, infant and early childhood mental health prevention services,
outreach to high-risk children and families, including foster children and children who have experienced trauma or ACEs, placement or care coordination assistance, and development of service plan that may be sustained over time for children in need of ongoing or more intensive individualized services. The commission will be required to develop matrix and a system to measure and publicly report on the performance outcomes of services provided using these grants. We will continue to work with the author's office and committee staff to address technical issues in drafting of the bill. Commission staff are working with the administration and legislative staff to pursue modifications for school mental health advocacy funding, augmentation for immigrant and refugee advocacy, and modifications to the Mental Health Wellness Act. We'll have additional information regarding those legislative priorities as the governor releases his May revised budget. So we'll be reporting more on budget items in May. And that concludes my update on our legislative priorities, and happy to answer any questions that you may have.
Thank you. Thank you. So at this time, I would ask if there are any commissioner questions or comments. Okay, seeing none, or Commissioner Tamplin? No?
I really want, part of what was discussed at the CFLC was, again, to talk about and bring the opportunity of the voices that are concerned about care courts to have a discussion about that legislation through the commission. So I just wanted to add that again to this agenda item specific to legislative priorities, because that is coming up quite a lot in our community. Just wanted to elevate it again. Thank you.
Thank you. Noted. Thank you, Commissioner Templin. Any other questions or comments from our fellow commissioners? Okay. So at this, are there any public comments? Please raise your hand now as the queue will be closing.
We have 2 public comments. The first one is Jason. Your line is open. You may go ahead.
Hi, thank you, commission members, and I'm Jason Robinson. I'm the Chief Program Officer for SHARE in Los Angeles County. I'm also a member of the Client and Family Leadership Commission or Council, the MHS OAC Client and Family Leadership Committee. And I urge the commission to oppose Senate Bill 1338, the Care Court. There's a wide body of research that shows that medication accounts for only 10% of people's well-being, and that forced treatment actually makes people less likely to use our systems. And I urge the commission to follow Commission Member Templin's suggestion that a meeting be held or a discussion to bring in the voices of people who would be subject to care court services, to hear from them. And there has been a lack of stakeholder process in this legislative item, and I think it's really imperative that the commission demonstrate its process and its stakeholder process to bring the voices to people who would be impacted. Thank you.
Thank you, Jason.
And next we have the phone number ending in 718. Your line is open. You may go ahead.
Yes, hello, this is Steve Leone. Thank you for letting me speak. First of all, I want to support the concerns that Commissioner Tamplin had. I was attending that meeting the other day, and I've attended most of the hearings virtually that the legislature has had. I wanted to say that I'm making this comment now because, in fact, this is an agenda item on legislative priorities, and I think this should be a priority. And here is why. 22 years ago, I was on the board of directors of MHAC, and Rusty Felix started talking about this young freshman assemblyman named Darrell Steinberg, and in response, Richard Van Horn, who went on to become a commissioner himself at this commission, started talking about the village model. And at that time, as now, there were people trying to expand LPS, et cetera. And what I heard him say was that they had a technique of outreach. It was slow, steady, very persistent, very non-threatening, and that people that you would think would never, ever take services had rejected them, came on board. Now, it could take a year or two for some people, but they were able to do this. And I was instantly taken with, on the one hand, you had all these clients saying civil liberties, you know, and you had family members saying, yeah, you know, my loved one died on the streets clothed in their rights, you know, and I saw this as a way to responsibly reach people out in the community who are not willing or able to take services, to actually reach them and bring them in without using force. You guys are the inheritors of that idea. That's what the MHSA did. That is, and I think it's been misapplied. I think it's been, a lot of the elements have been forgotten. It was a heavy lift to try to make it happen, and I think it failed. And there's a lot of data that's missing. I know you as a commission have spoken, have asked the legislature for data on full service partnerships because DHS was unwilling to collect it. So that's to show you how bad the data is. You need to know that care court is extremely controversial, very divisive, and you're sitting on top of a way of reaching people that's non-controversial, seems to have data supporting it, and you need to be part of the conversation at the very least. Otherwise, you're simply ignoring your heritage. Please consider this. Thank you.
Thank you, Steve. And thank you, Commissioner Templin. I want to say that I have reached out to staff, and I want to ensure that I have asked staff to reach out to Commissioner Templin and other commissioners to really an opportunity for the commission to engage. So please note that that is in the works. And I appreciate all the comments on this. I know this is something that we do want to discuss. So please note that there is movement towards this. So thank you, Commissioner Templin, and thank you for those comments. And Steve, for that comment that you just made. So appreciate all that. At this time, I would ask, I see no other community input. Is that correct, Mariani?
Yes, that's correct. There is no more public comment.
Thank you so much. So I would ask.
Oh, we actually just had a hand raised. Would you like to take the comment?
We will take this last comment and then let's close the queue, please, at this time.
Okay. The phone number ending in 837, your line is open. You may go ahead.
Mark Carmatz again. I also would like to oppose Senate Bill 1338, and I would like to, and I think it sounds to me that it's kind of an assault and battery on the rights of people with mental health issues. Now I understand that it kind of addresses the issue of homelessness. That's vital. That needs to be addressed. But to the assaulting on people on the rights of people, no, don't do it. So take a look at this, rewrite it. If it comes out for something that we feel that we can use, okay. But as it is written now, no. I want to make Katerra's, Farmy Templin's comments stronger, and the same with Steve Leone. Thank you.
Thank you, Mark. Thank you again, everyone, for your comments. At this time, we are going to move forward. So this was not an item to be voted on. So we have moved to the last item on our agenda, and that is the adjournment. On behalf of my fellow commissioners, I want to thank everyone who joined us here today. Your participation serves to continue the work and discussions around mental health in our state. We would especially like to thank members of the public. We value your input and represented perspectives. Our next commission meeting will take place on Thursday, May 26th. We look forward to seeing you all again next month. At this time, our meeting is adjourned. Thank you, everyone. Have a wonderful rest of your day. Take good care.
Thank you.
Thank you.
Bye.
Thank you.
Thank you. Take care, Chair.
Take care, everyone.